Hey, what brought you in today? Thank you so much for coming. Okay, let's talk about it. Yeah, I've been to the store and I picked some vitamins A, B, C, D, F, and I just think I should have some supplements. And I'm just coming in today to ask if I can take more supplements. Wow. All right. So, supplement. How did you get the supplement? Who recommended it? And for what purpose? I just think, the supplements, I find them over the counter, and I think it would be good, just to drink some supplement to take care of myself. Oh, okay. Yeah, like supplements, like the name, like it implies, it is to supplement, like most of those properties of the supplements, we are actually producing them naturally in our body, but when there is a kind of deficit, yeah, based on your presentation or the assessment of your clinician, the clinician can recommend, to keep you in health, that okay, this the supplement that you can get over the counter, because like in the United States, most supplements are over the counter for the people to buy. But despite that, it is still advisable, that you get the recommendation from your clinician. And it is a good thing that, like checking your health, health is wealth, is the health, that you have the health, to get the wealth, get the money, enjoy your life. So it's a good thing that you look after yourself. It's very important. And when you go to your clinician, make sure you ask questions, any concerns, any, thing that may be bothering your mind about your sleep, about anything new, that you just observe, oh, this is happening, that is happening. Is there anything that, yeah, I should worry about? Is there anything that, we can do anything about it? Ask your clinician any question. Yeah, they are willing to ask you, to answer you. I mean, it's because you're not asking. It is your right. It is, part of, health, seeking treatment therapy, that you ask questions so that you can get clarification. And as I said, when during assessment, make sure that you do your annual checkup every time, and your all those record of the lab work, the blood work that you have taken, they are like baseline that is kept, and then future assessment that you are um your clinician is able to assess you. They have like a reference that they can always look back, that oh, this is the baseline, the last time that you came for appointment, this is what the record are, this is what the numbers are. And then he's able to it is helpful, and they are able to track, where the beginning of anything, that oh, this was not there the last time, then this is the beginning of this new problem. Unlike, everything become complex, complicated, we don't know the beginning, the origin, of situation that you are going through. We don't know, maybe this has been ongoing for some months, for some years. But when you go, through your annual checkup, when you attend, your assessment every time, or through your discussion presentation, there are certain things, when we are engaging, with clients, and we are talking and all that, then we're able to, yeah, to discover that, oh, that thing that you just said is really important. Okay, tell me more about it. And to you, you may just, just belittle it, or not counting it to be anything, but having that conversation, and that discussion with your clinician, bring, points out, the big thing that you are really dealing with, that you did not realize is, something to pay attention to. And then from there, your clinician will know, to send you, for lab work. And like vitamin D is very common, it's over the counter, but it's part of the chemicals, that we produce in our system. It is only when it is low, we get it from our food, from vegetable and basic food that we eat. But when it is low, then we may need, to supplement through all this over the counter supplement. And when we need to supplement as well, at what level, at what doses? If, like everything is okay, you are eating well, there's no any other underlying disease process, then we don't need to take some of those supplements like vitamin D. Let's say people that live in warm regions and all that, they don't need it because they are producing what they needed from the food they are taking. But when it is low, we want to know how low it is, like through, it's only the blood work, the lab work that can give us, an insight into the internal environment of your internal system, your internal organs, how everything is going. And remember our vital organs like the kidney, like the liver, that they are processing the medications and food and all that. We don't want to over stress them or overstretch them and make them to be sick as well. When those vital organs are sick, like the liver and kidney, is a big problem. So we have to be careful, not just taking every kind of supplement that we see over the counter. Like I said, we want to check how low is the vitamin that we needed, to supplement. Some maybe just a little bit low, and then maybe you just need a lower dose for maintenance. Some maybe it's just slightly or moderately low, then maybe you need a little bit of higher dose. But there are some that they are really, really very low, and I've seen, like I said, clients that live in cold region, for the example of vitamin D that we're using, that they needed to take higher level of this like vitamin D supplement, that you can't even get them to buy over the counter. They become a prescription drug, and then we have to give it, for some months, and then we monitor again, send to the lab maybe after like 2 months to 3 months, and see how it is, because we want to reduce it. Like I said, we don't want to really overstretch, their system, their organs. So all those supplements, be careful with it. We don't want, interactions, with like other medications to maybe taking, and then we don't want them to complicate some other disease condition or your essential organs. So it is important, as I've said, like good nutrition. If you are eating well, good fruits, good vegetables, all the classes of food in moderation, you don't need most of this supplement. Number two, make sure you're exercising, move your body. It is very important, and make sure you have adequate sleep, and make sure you do your regular assessment, see your doctor, see your clinicians, and they know your numbers, your weight, your blood pressure, your glucose level, all those numbers, through your lab work, because you are looking out for yourself. Nobody will say look out for you like you will look for yourself, and you want to keep this essential vital thing that you are, which is your health. It is, your health that will determine your longevity, that you will determine, how you are able to enjoy life and other things. So even the money you've labored for, you worked for, it is through taking care of yourself, that your system, your organ, everything is in good shape, that you can enjoy. So it's really important. That's why I said we should have this conversation today about not just taking any supplements, but have that conversation with your clinician. And at times, yes, I know when people are stressed, that maybe they don't have time to take really good food. Yeah, even if you are stressed, a lot of our clients, they come and said, oh, the workload in my place of work, more responsibilities, people are retiring and they are not taking new ones, or people are being laid off and then they are getting increased workload, which is really overwhelming to them and causing stress. Or some, it maybe is due to some other reasons, maybe family responsibilities, taking care of the family, the children, and all other roles that they have. Yeah, and then when the stress level is increased, it can lead to high stress burnout that can yeah, affect our immune system. And when it affects our immune system, like inflammatory processes, that